Right now in the world of mental health, people still struggle with stigma. They still struggle with fear of being judged. We had long access times, we had long accessibility to service times, and people were struggling.
So much of behavioral health is an influence of the environment that individuals live in. This is a different kind of public health issue. It's not only, with the legal drugs and things, but we know that prescription drugs are equally at fault here.
And there's no other epidemic or crisis that is more important than this right now. And our community is really coming together to develop a solution.
There's a great saying out there that says you have to make care as accessible as it is to get high, or as accessible as it is to commit suicide. We have to make care easier than that, easier than it is to get high. And we can only do that through our great partnerships.
In the United States, our suicide rates are going up when they're going down the rest of the Western world. And Missouri rates are higher than US rates. Greene County rates are higher than Missouri. And so we know that we're at the very eye of the storm, and the rest of our community doesn't understand that, I think. So the good news is the data can help articulate the problem that our providers know about, and then hopefully that brings us together to make those changes we need to improve.
In the initial kickoff of the community assessment, access was the problem then. Access is the problem now. Access is going to be the problem for a very long time. Everybody wants to address it, but the resources are just not to the level of availability that they need to be for the Springfield and surrounding communities.
Our local healthcare partners in both Mercy and CoxHealth were extremely important. They had worked around some of the deficits of community mental health over the past few years, and Jordan Valley Health Center was also an entity that really stepped up and said, if we need more services here, there's a gap, why don't we look at things that we could do as an organization to do our part, so to speak. And so right out of the gate, what we wanted to do is we wanted to create more access points for people. We can't wait for people to come to us. We have to go to where the people need us. If you go to your primary care doctor or you go to the emergency department, there's a chance that you're going to have a behavioral health expert, a Burrell employee located right in one of those organizations.
While it takes a whole community to work together, the catalyst for much of this has been the health department, the leadership of the health department, the team there, putting a face on this picture. And so I'm really grateful for what they have done, and it's really kind of compelled us all to work together more closely.
It's not like treating a cold. It's not like treating a filling. Behavioral health's not like that. And I think that's really the challenge as we've looked at it. Putting the small pieces together to make the big puzzle is going to be the solution that we have. And everybody, I think, is committed to it within our community, the big stakeholders as well as the smaller ones.
Because we're seeing very rapid response to these issues that we've never seen before, and I attribute the health assessment in part being a mechanism, this community assessment, to get us together and remind us that we can cooperate and work together, and it's really been very material, and so there's a lot of hope in me, and that we'll see these problems turn the positive direction.
Our hope for the future is that we can be as proactive as possible and continue to meet the substance abuse and mental health needs that our community faces. It's a crisis right now, and we're being reactive, but our hope for the future is that our organizations, agencies that are involved in the Healthy Living Alliance continue to come together to be proactive and to develop the programs that our community needs in order to stay ahead of this.